everyone, my name's Jen. I'm also known as the Chronic Health Advocate, and I'm coming to you from a chronic health patient, parent of someone with a chronic health condition, and also a professional perspective. So my intention today was to go over an update to a brushing therapy video that I uploaded, I think it was about 10 years ago, and so I thought I would update everyone on how it was going. I had put it on years ago and hadn't realized it would get as much traffic as it did, people coming in and were interested, so I just thought I'd update that. Before I start though, I have a fun fact, as my daughter would say. We have 2 cats and one very energetic dog who I had to bribe her to stay in the bedroom. The first time I tried to record this, she was very, very noisy and couldn't hear. So yeah, so if you're not familiar, the Wilbarger Protocol, I'm not sure if I'm pronouncing that properly, it is a technique that's used for people with tactile defensive issues. So it'd be like sensory issues. So that could be someone with autism or also any other condition that involves sensory issues. In my son's case, he has Angelman Syndrome, and sensory issues definitely come with that. So with the protocol, typically what's done is there's a series of brushing that are done with a brush like this, or could be different depending on what your OT asks you to do. And this one's actually in good condition. The dog really likes to eat these. She has some type of plastic thing. Yeah, so this one's still quite good. So within that, there's a regimen for doing brushing on the hands, it's most of the body. There are parts that the brushing doesn't occur on. It's to give the sensory input. And then there's also the second part of that protocol is our joint compressions that are done with the fingers, wrists, knees, hips. It's done with all the major joints in the body. So if you want more information on that, make sure to check with an occupational therapist. There is certainly information online, if you go into any like good autism sites, or you can look at videos in that too. But before you start anything, I would recommend just checking with your occupational therapist or your child's occupational therapist and just making sure that it's safe before you start anything with that. So in my son's case, we found that it wasn't very effective, and it certainly didn't. I'll tell you why it didn't work. One of the main concerns was the time involved. When I first was introduced to this, they did tell me that we should be doing it every 2 hours at the most during all the waking hours. And so we had to go through all the brushing and the joint compressions. And at the time, I didn't have any help, and his father was at work, so I didn't have that help either. And he had a lot of medical appointments and just a ton of issues that were going on. And so for me to make the time to try to do brushing every 2 hours by myself, it was really difficult. So that was one of the major issues for him and why we didn't continue doing it. The other was, at the time, we were asked to do the joint compressions. My mother's intuition, I just knew that there was something off with that. He had very loose joints, and so we were worried about, I guess dislocations is what I was worried about at the time, and or it coming out of joint. And so ironically found out years and years later, so this was only a few years ago, that he has a second genetic condition called Ehlers-Danlos syndrome. So that's on top of the Angelman syndrome. And with that condition, it compromises all of the connective tissues. He's at risk for subluxations and dislocations, and it just wouldn't be safe to do with his joints, which I knew at the time. He was too loose. So we couldn't do it with the Ehlers-Danlos. The other issue, if we were to say start to try an all over body sensory brushing, now, because it's actually quite a heavy brushing that they expect you to do, is that he, because of the connective tissue disorder, bruises very, very easily. So it just wouldn't, we know that it wouldn't work for him because it would damage his skin and he would bruise. So in the currently, how we do use the brush is that we do find it helpful sometimes for tactile defensiveness. So if I were to want to cut his nails, which any parent of a child with Angelman syndrome knows how great that is to try to cut nails. I would suspect someone with autism as well would be very difficult, haircuts, nails. So I would do the brushing on his hands to give it a little bit of, just helps with the tactile defensiveness, whereas normally he would reach and grab away. It gets him used to it for if you're doing something else with his hands. I also really like it for his feet. He has problems with kind of blood pooling in his feet and circulation, so he seems to like this. We massage his feet a lot and use that. So I was wondering, anybody who's viewing, if you've used the protocol, if maybe you could tell us if it worked for you, if it didn't work for you, if you continued it long term, what issues you had, and if you'd like to leave a comment in the comments section, that would be great. And also, I forgot to mention, I will link the original video that inspired this video, the original we did 10 years ago. I'll link it to this one, so if you haven't found that yet, you can refer back to that. And I also would like to ask you to subscribe to the channel. So I do have a lot of videos coming out soon. I'm a registered social worker, and I'm going to share some information that I've gathered over the years as someone with, obviously I have an 18-year-old with very significant disability. I myself have a chronic health condition, so I'm very familiar with the adult world and peds. And being a social worker and working with people with chronic health conditions and disabilities, we all need like really practical, easy to follow advice and tips. So subscribe to the channel and then you won't miss any of those. And it's been, thank you.